Hello, everyone, and welcome to another episode of Plastic Surgery Unfiltered. I'm your host, Dr. Armando Davila. Today, I'm joined by Katie Enos, one of my PAs. She's our special guest today. And today, we're going to be talking about the new med spa philosophy.
Love it.
Sound good?
Yes.
Okay, well, we have another episode, Katie, about my opinion of the death of the current iteration of med spas. Mm-hmm. And you have sort of a special experience we can talk about today. I guess just introduce yourself, tell people kind of where you're from and what's going on. So
I'm Katie, one of the PAs here at the Pittsburgh Center. And I kind of have a unique experience with the Pittsburgh Center. I actually had a rotation here while I was in PA school. And then I accepted a job here. I did a fellowship training with Dr. Davila. I worked here for about 1.5 years, and then my life took me to Florida. So I ended up going to Florida for about a year, a little less than a year. And Dr. Davila was so gracious to bring me back when I wanted to come back to Pittsburgh, which I missed so much.
And we're happy to have you. So
yes.
So, Katie, I think that you got to work at I think it was it owned by a private equity group?
Yes.
In Florida?
Yeah.
Tell me a little bit about kind of what it was like there. Like, what kind of services did you offer and kind of how was that sort of set up down there?
Yeah. So it really was that like quote unquote like med spa. And I offered injectables, kind of the same sort of aesthetic treatments, injectables, Botox, filler, that sort of thing. And then also I did dive into a little bit of the hormone replacement, weight loss therapy. But yeah, it definitely was that med spa experience, and where it sort of did feel like to me that sort of like quick fix or like quick stop, where I didn't feel like patients really understood their why and why they were even there.
Yeah.
So
yeah, I think that's, I think that it's one of the things that we're sort of working for. Right now we have our for everyone who doesn't know, we have our spa shut down, our Rejuvenation Center shut down. And one of the things that we've been really trying to work on is less sort of restructuring the physical space. I think the physical space has stayed pretty similar, but I think really restructuring how we approach like the care or the more whole person care that is been lost, I think, in this kind of med spa environment. One of the things I wanted to introduce or get your opinion on is just, how we have these 3 lines, right? Mm-hmm. And the way I think about our lines is treating all levels, right? From the Illuminix line, kind of starting with light and kind of a surface, the Verve line, which is a deeper treatment, and then kind of the red carpet line, which is a both sort of holistic, like a core-centered philosophy, but also sort of a supportive system and a maintenance philosophy. Kind of, what is your take on? Let's start with one. Like, Verve. What does Verve like mean to you? What do you think about when? Yeah,
like when I think of Verve, I do think that they are treatments sort of like at that deeper level. Like a word that comes to my mind is like vitality, or energizing sort of. And where yes, these treatments are going to be targeted deeper level, but they do play in well with our Luminex and our red carpet, series. I think that we've really been focusing on this journey, right? And that most people won't just be getting services from the Verve line.
Yeah, I think that's the big crux of the whole kind of concept, which is that the way most of these spas are sort of set up is that you essentially have one service line or one market line that is sort of advertised and sort of people brought people in, right? So it's like, oh, I get Botox at this place, or I get, my lips done at this place, or whatever it is. And the idea really is that you can't just treat one without the rest. And I think that that's true of really all of us in life, right?
Yes.
It's like we all want to like work on one thing at a time, one thing within ourselves. But really that you have to step back sometimes and look at ourselves as a big picture item, as the infinite game, as
Yes.
Simon Sinek says, that you have to treat this sort of multi-level thing. And so, the verve line is, you're right, our kind of interior line, so to
Yes.
speak, like what's underneath the surface. But then it gets combined with these other things. So how do you got some laser experience and you got some like light-based therapies as well in Florida. What is your take on kind of Illuminex as well?
Yeah, like Illuminex, just kind of like starting off from even the name, people may not have heard Illuminex before, right? And when I think of that, I think like visibility, clarity, where you're really focusing on the like surface level things, right? Now, while some of the lasers can go a little bit deeper, but really refining kind of like the surface of our skin or whatever it is, even on our body. So that's kind of how I see Illuminex.
Yeah, I mean, I think that what is it? Never judge a book by its cover, but everyone judges people by their cover. And so the skin obviously is the first thing people see in a lot of us. And so I really like the name Illuminex because to me it is about both illumination of who we are, right? Seeing us, right? People see us. That's the first thing they encounter. Yep. So it is the first thing that brings us into who we are as people when they encounter us. And so I think, everyone has dealt with this. I was talking with the PA student yesterday. It's like, right, everyone when they're young has had bad skin or acne or all those sort of things. And people know what it feels like to be judged because of that. And again, not it be a reflection of who you are and not allowing it to sort of illuminate your inner self, right? Yeah. And so again, to me, Illuminex is this first thing that helps treat this sort of outer surface that lets kind of the rest shine through. And so, and then it brings you into kind of the vitality and the verve. Yep. And then how about you, if you want to introduce like red carpet, what does red carpet mean to you? And
so like our red carpet.
Our oldest line.
It is, yes. Red carpet, to me, this is one of our lines, like one of our really great supportive lines, right? As you come on a journey here, like at PCPS, I think that while, yes, you can do your like Verve and your Illuminex like treatments, it's, you truly are on a journey and you need to do those like supportive treatments, right? And this is where you'll have the treatments that really like enhance the inner beauty and you feel more confident. These are like less downtime procedures where you can kind of come in and just really like get a holistic experience with the red carpet line.
Yeah, like I went to, so I was in Bedford, I went to Bedford Springs and, I went to their spa and I really started talking with them, the providers there about, what is a spa? Obviously Bedford Springs is sort of an interesting place because it's based off these like natural springs that were in the area. And the history of it is kind of cool. They're hundreds of years old and it was sort of this place that was meant to be cleansing and healing. We just talked this morning about, clarity through nature or cleansing through nature. And that's at its core, right? And so I think about why I go or why people go to a spa, right? And so I was thinking about that as I'm sort of lying there, getting my facial, getting my massages, right? It's to really we go, life is hard. Life is dirty, it's messy, and along the way we kind of get all grimy, right? And so to me, these moments where we go on these kind of more spiritual explorations in these environments are really about sort of washing off the grime of life, okay? And kind of helping us re-find ourselves after we've gotten sort of messy. That's why I really hate the term spa associated with, I don't know, they didn't know what else to call it, but like a medical spa or really what we do here is not about in some ways cleaning off the grime or restoration, even though we are doing that. Like I go, they kept asking me, are you comfortable? And I go, well, yeah, I guess in a traditional spa, the point is to be comforted. It's not to experience pain. It's not to experience growth. It's to sort of center yourself and find yourself again. But we cause a lot of pain, right?
We do.
Yeah. And And the reason we cause pain is because you cannot have progress without some pain. Okay.
That's correct.
And so what we do here is not restorative in that sort of sense from a holistic perspective. To me, it's like we're making progress, and that's why PCPS starts with progress as the first thing. And so progress is pain, progress is growth. Obviously progress is growth, but it's swimming upstream, which is challenging for people. And so that's why I don't like the word spa, because spa sometimes implies this sort of
like fluffy experience,
relaxing, centering thing, and that's not really what we're doing here. Have you been to Bedford? Yeah.
I haven't.
You haven't been. Okay.
I need to though.
When was the last time you got do you like massages? I don't know.
I do. Yeah.
Okay.
Like massage or facial. It was probably like 6 months ago.
Okay.
Yeah.
And so what do you kind of like feel during those experiences? What is your kind of like goal, I guess?
Yeah. Like, usually you go in and you're like, they ask you what concerns you have, and, and you tell them, and you might fill out a paperwork or whatever. And then, it is really about like feeling pampered, I guess, like relaxed. They want to make sure you're relaxed. But again, they never talk to me about like, what should I do next? How many times should I come? Like that stuff is never talked about. And so, I do feel like it's sort of just this like refresh, sort of speak, when I go and get like a facial. So, and
I think that's where even the current med spa system tries to balance this line, and it's a little bit challenging because people do come in with that terminology. They say, hey, can I get like a refresh? And it's like, we can do that, and we're happy to. I think we have that ability to give people a one-off kind of experience and go back to sort of that traditional methodology, but really it's not about that. It's about kind of caring for the whole person. Yeah.
I mean, really, it's like I, as a provider, want to meet people at like whatever age, stage they are in life, and like really come on a journey. It's not like a quick, fix.
Sure.
And so there's always things that we can be working on as individuals. So
yeah, and I think that's a great thing, like meeting people where they are, and we're happy to do that too. It's when we meet people where they are, it's an understanding of the journey can be whatever they want it to be as well. So someone can come in and tell me, well, hey, like, this is what I want. This is my budget. This is how long I expect to do this. And it's like, no problem. We'll find something that works for you and your journey.
Yes.
But it's not going to be a, hey, you're going to come in here and list out this journey I want, and then just not do any of that. Right. And I mean, we all have our things. I mean, I wanted a dog, or we've had dogs, but I'm allergic to dogs, right? And so I signed up for this thing where you get the drops and you put them under your tongue, and all you have to do is pump the little thing under your tongue every day, And I still didn't keep up with it, you know, and that's life too, right? It's just that I obviously can't expect that. Hey, I didn't keep up with my drops, and now when I go get the dog, I can't go back to the company and be like, "Hey, I'm still allergic to dogs." Keep up with it. So, you want to talk a little bit? I know we have the opening coming up. Anything you want to talk about from that perspective? I don't even. You've been planning it all. It's going to be a surprise for me too. So
yes. Yeah. I mean, well, it's super exciting. Like for all of us here, it's kind of been a long time awaiting for this. It is October 16th if you want to RSVP. But yeah, so we really want people to come in and really understand like our lines and really the reason why behind all of the things that we do here. I think that's like the most important. I want all of our patients to understand like why they're going on a journey, why it's not like a one-stop shop or like a quick fix. So that's really what we want to portray at our event. And so I'm hoping that it is a really great experience for everyone that comes.
Yeah, I'm sure it's going to be excellent. I mean, and one of the things that I really focus on is this might not be for everyone, right?
Yeah, definitely not.
Not everyone has to go on a long journey with us.
Yep.
They get to choose. They can go somewhere that suits more for their needs, but that's really what we want to offer them. And I think that, I've talked with you a lot about that Simon Sinek has been a big influence for me with his, start with why, leaders eat last, and infinite game kind of mindset. One of the things that I So it was my anniversary this weekend, and it's our 9th wedding anniversary, and my wife and I like to stay on theme.
Yes.
And so this year's theme was the traditional gift is pottery. Okay. And man, I had no idea what I would have gotten from pottery, but my wife like knocked it out of the park. She won the gifts this year. So she actually bought me a kintsugi set.
Okay.
And for those who don't know, kintsugi is the Japanese art of taking broken pottery and melding it with gold. And the idea is that through scars and through healing, we can take something that was broken and make it more beautiful than it was even before. And that does not mean that we've melded it perfectly and that it has invisible, we didn't take super glue and like try to get it so you don't see the scars. The scars are visible. They're visible for all to see, and they're visible in gold, right? So your piece of pottery proudly wears the scars of the journey it's been on. And so, number one, it was pottery, so she like nailed it.
Yes.
Number two, we had this opportunity to sort of reflect on our marriage, take things that were still part of the baggage that we carry. We got to ceremonially sort of like break the pottery and then meld it back together. But it really helped me. It's in the Simon Sinek books. And so it helped me really reflect on the idea of what we do here. Again, people come to us from all walks of life, from all sorts of journeys. Everyone has their struggles. No one comes in perfect, and they're certainly not going to leave perfect. That's not the point. And even the act of having surgery or whatever creates scars, and they should be, in my opinion, sort of proudly worn, right? Patients who have lost 200 pounds, have made massive changes in their life, who now have scars from that journey. Yes, it's a reminder, but also sort of more beautiful now that they're sort of joined through their progress. And so, I love seeing one of our ex-patients just got married, not ex-patient, she's a patient, but got married. And it was great to see her just sort of like proudly living her life and moving forward, and how she's inspired others. And so, yeah, that act of kintsugi is also part of that process and journey that I see here, that we're not here to make perfect beings. Yeah. We're only here to keep being better together.
Yes.
You know?
For sure.
So I guess we can start to wrap up, I guess. Anything else that you had on your mind about like the event or the launch?
No, I mean, I think that I'm excited for everyone to really, like I said, understand like our why behind all of these things. We've taken a lot of time to put this together and really like create our philosophy and things like that. So yeah, I'm super excited.
Oh, fantastic, Katie. So, join us on, what was it again?
October 16th.
October 16th. I'll be there.
Yes.
As long as someone reminds me.
You better be.
But thank you for joining us for another episode of Plastic Surgery Unfiltered. As always, I'm your host, Dr. Armando Davila, and we were joined today by Katie Enos.
Thanks for having me.
We'll see you next time.